I'm so happy to be here as a part of Juneteenth empowering and education for our community. I do have some slides that I would like to share with you all as part of our education. And if someone could just write in the chat box if they see, oh, perfect. I see it myself. This is wonderful. So I'm going to go through what does heart disease and stroke mean, some social determinants of health, also things that we can do that empowers ourselves and gives us sort of tools to navigate our own health within the health system and improve our health for the long term. Because I think information is power, and with that information, you can change the course of your life. So let's dive right in, and we are going to start with the definition of cardiovascular disease. So what does this mean when your doctor says we are trying to prevent cardiovascular disease or you have cardiovascular disease? So cardiovascular disease essentially means a disorder of the heart and the blood vessels. So there are some examples listed here. Artery disease of the heart, so that's coronary artery disease, high blood pressure, which some folks call hypertension, particularly in cardiology, congestive heart failure, artery disease of the legs or peripheral artery disease, stroke and TIA, which we call cerebrovascular disease, and you may have heard CVA for short, and some arrhythmias and valve disease. So what are the statistics in the United States as it pertains to cardiovascular disease? So unfortunately, in the United States, heart disease is the leading cause of death in the US. Artery disease of the heart is the most common type of heart disease in the United States. And this is no longer the disease of the elderly. This is a disease that affects younger and younger folks in our communities, and over 18 million adults in the United States who are the age of 20 or older have artery disease of the heart, have coronary artery disease. That number is shocking, right? But I do see this in the hospital. Younger and younger patient populations coming in with chest pain due to blocked arteries, needing intervention. 2 in 10 deaths are from artery disease of the heart, from coronary artery disease in adults under the age of 65. And in the time it took me to say this slide, someone had a heart attack. Every 40 seconds, a person in the United States is suffering from a heart attack. So what factors increase your cardiovascular disease risk? And these things we can target and have actionable intervention to reduce your risk. Obesity, and we'll get into what BMI means, diabetes, carotid artery disease, so you have 2 carotid arteries, one on either side here in the neck, peripheral artery disease, blood cholesterol, and smoking, in addition to not exercising. That's what sedentary means, sedentary lifestyle, no movement. So what are the heart health disparities by race and ethnicity? And I won't get into all the racial and ethnic disparities because I want to focus on the Black American, African American, and Afro-Latinx population. So the statistics are as you see here. So these populations have 30% more likelihood to die of heart disease, 40% more likely to have high blood pressure, which is hypertension, 2 times more likely to have a stroke or have diabetes, have higher rates of triglycerides, which is a type of cholesterol, higher rates of heart attack, death from a heart attack, higher rates of heart failure, peripheral blood vessel disease, which we keep mentioning, artery disease of the legs and the belly, and obesity. So how can we address these disparities, right? We don't want to look at these disparities, oh my gosh, it's hopeless. You know, the inequities that have persisted for hundreds of years, you know, there's no way of overcoming it. That's not the message. Disparities can be addressed, inroads can be made, and success and improvement in health outcomes and improvement in health equity can be achieved. So this pie shows you, all the different colors show you the contributors to health disparities, and we'll mention them here. In brief, right, this is just a few of the contributors, but insurance, access, bias, translation issues, right? These things can be addressed by providing translation services, providing bias reduction training and cultural sensitivity training, providing community outreach and education and access to good quality food and healthcare and insurance that's equitable. So tailored interventions for our Black American, African American, and Latinx communities from the Latino or Afro-Latina population, increase awareness and education is paramount. If you don't know, right, then there's a passage from the Bible for those who are biblical scholars. You know, my people perish for lack of knowledge. And so you want to increase awareness and improve education regarding risk factors. You want to increase awareness and education regarding symptoms. So both risk factors and symptoms, and then you improve access, right? How are you getting the care that you need? So early intervention and prevention, as well as after event care. So there's two prongs. There's primary prevention, which means you have never had a heart or blood vessel event in your life, so we want to prevent a first event. Or secondary prevention, which means unfortunately you've had an event, you've had a stroke, or you've had heart failure, you have artery disease of the heart, and we want to prevent subsequent events or complications. We also want to employ community-based, ethnically intuitive nutrition programs. That means I can't come and talk to you about kale if you've never seen kale, never heard of kale, it's not in your vocabulary. I talk to you about quinoa. You've never seen quinoa, you never heard of it, never seen it, it's not at your local grocery store. We have to know what's available in our local communities and then tailor the recommendations to what's available, because there are healthy options in each part of our communities. Apply tailored drug therapies. So what does this mean? In brief, there are some medications that have better outcomes in certain patient populations. And if your doctor and you are not working together to tailor your drug regimen to your specific needs, right, then that you may not be getting the optimum bang for your buck, so to speak. You may not be having optimal outcomes because you may have a generic drug regimen, but if there's a certain drug that works better in women or African Americans or patients who have diabetes in addition to heart failure, right? These are tailored drug regimens, and both patients and physicians are now noticing and noting the importance of having a tailored drug regimen. So patient-specific treatment is key. So how do you empower yourself? There's a mantra at the AHA, which is know your numbers. So I try not to give an education session without this, right? So know your numbers is key. The first number we're going to go over is the number of weight and body mass index and weight line measurements. You know, I usually sort of get, folks get trepidatious or anxious and nervous when the scale pops out, but it's important, right? It's important if you're too low or if you're too high. So what's BMI? BMI is a measure of your body mass in relation to your height and your weight, and it applies to both men and women. And carrying too much weight for your height can increase your risk for high blood pressure, diabetes, heart disease issues. But a weight that is also too low for your frame, for your height, can increase your risk of malnutrition, right? Being undernourished, being anemic, a low red blood cell count, and the red blood cell is very important because it carries oxygen and nutrients throughout the body. So you want to avoid anemia, osteoporosis, thinning of the bones, leading you at risk for fracture or bone breaking. So both too low and too high of weight have negative impact on your health. We have waistline measurements both for women and men here, which you can see. And I hope you get the slides so you can review on your own time. Blood cholesterol is next. So what's important about blood cholesterol? I think the big takeaway is there's good and there's bad cholesterol. All right, so there's total blood cholesterol, LDL, which is low density lipid, HDL, which is high density lipid, and triglycerides. So your total blood cholesterol should ideally be under 200. The low density cholesterol is a sort of sticky cholesterol that deposits in blood vessels, particularly in your arteries, and think of it as peanut butter in consistency and stickiness. You want that number under 100. If you already have artery disease of the heart, say you've had a heart attack before or you've had a stent placed, then you want that number under 70, not under 100. You want it even more strictly controlled under 70. Your HDL, high density lipid, think of it like a bowling ball. That is a protective type of cholesterol. Optimally, right, you want that number over 60, as high as you can get it. For men, it is acceptable or in the good range to be over 40, and for women to be over 50. But this is a protective cholesterol number against heart disease. Triglycerides, so that's that last one here, less than 150 is the goal. How do triglycerides rise? So they're affected by our intake of simple carbohydrates. What does that mean? It's simple sugars, candies, cookies, cakes, foods with white flour. Fructose, alcohol is another big one that affects your triglyceride level. So triglycerides are a number that you want to keep low, just like your LDL and just like your total blood cholesterol. The next number we're going to go over is your blood sugar. So blood sugar, normally if you're fasting, meaning you wake up in the morning, you haven't had any overnight snacks, you haven't gotten up and raided the refrigerator overnight while you're sleepwalking on your way to the restroom, right? When you wake up, if you check your blood sugar, it should be less than 100. So putting you into the high risk category, sort of the yellow zone, the watch out zone, is these numbers here, 5.7 to 6.4. The diagnosis of diabetes is when you hit that 6.5. So it's 6.5 or over, that is a diabetes diagnosis. For those who already have diabetes, who are on treatment, your goal is to have that hemoglobin A1C less than 7. So what is a hemoglobin A1C, HbA1c? It's a measure of how well your blood sugar is controlled over the past 90 days. It's retrospective, it's a look backwards. How is your average daily blood sugar for the previous 90 days? Hemoglobin is the part of your red blood cell that carries oxygen to your lungs and other vital organs. Its shelf life is about 3 months. And sugar that attaches to the hemoglobin is measured with this test. And so that's why it's a 90-day snapshot, because that's the average lifespan of a red blood cell. So you can think of it as the saturation of your red blood cells with sugar. You want them less saturated versus more. Next number is blood pressure. So we have a normal blood pressure, we've got an elevated blood pressure, and what meets criteria for hypertension. So I want to clarify this slide and say normal blood pressure is less than 120 on the top over less than 80 on the bottom, right? So it's not that 120 or less on the top and then whatever number on the bottom is okay. We want less than 80 on the bottom. Elevated blood pressure, meaning again yellow zone, is the 120 to 130, over 80 to 90 on the bottom. And the criteria meeting hypertension, there's many stages of hypertension, but a diagnosis of hypertension is when you hit 130, over 130, so 131 for example, over, on the bottom number, over 90, so 91 for example. So what is the top and what is the bottom number? So the top number is called systolic blood pressure. Systolic blood pressure, every time your heart pumps, that's the pressure that is exerted on your artery walls. That's the pressure your artery walls feel every time your heart pumps, right? The blood vessels stretch, feel that wall stress, feel that wall pressure, and then relax. That bottom number is the relaxation pressure called diastolic. So in between pump, when the heart is resting, What pressure are your artery walls feeling throughout your body? The vessels in your brain, the vessels in your liver, the vessels in your gut, in your heart, what are they feeling? Which is why both numbers are important. You don't want your artery walls throughout the body and in your vital organs to feel high excessive pressure, either while the heart is pumping or while the heart is relaxed. So now that we know our numbers, we have to know the symptoms of heart attack and stroke. Heart attack symptoms, the most common is chest pain. Regardless of whether you're a man or woman, the most common symptom is chest pain or pressure. So we also have associated with that, we call typical angina or typical chest pain. You can sometimes get pain radiating down the left arm, in the neck, or into the back. Sometimes we have complaints from our patients of upper stomach pain, we call epigastric. So that's that pain here right below the rib and in the upper stomach area. For women though, women can present with atypical quote unquote symptoms. And I say that in quotes because the symptoms are rather typical for women. We just don't recognize them as chest pain syndrome symptoms. So we have to be aware that lightheadedness, dizziness, feelings of heartburn, feeling sweaty, what we call in medicine diaphoretic, feeling extraordinarily fatigued with nausea or vomiting may be signs of heart pain or heart attack, right? And so if this is especially accompanying symptom of chest pain or pressure, please seek treatment 911 nearest emergency room for evaluation. Your only job is to listen to your body and then respond. Our job is to make the diagnosis. So there's no wrong move. If you're concerned and you say, I don't feel right, I feel off, leave it to us to help make the diagnosis. Don't spend the time, the precious minutes, trying to self-diagnose. Stroke symptoms, we have two. There's FAST and then there's BFAST. So according to some prior stroke research, the BFAST helps you identify about 10% more stroke patients quickly. So if you remember BFAST and can do it, this helps identify about 10% of more patients. So BFAST stands for balance, eyes, face, arm, speech, and time. So what's balance? Balance, you lost balance, right? You're sort of what we call in medicine ataxic. You're not walking really well, you're weak and wobbly, you may have a headache or feel dizzy. Your eyes, you've sudden loss of vision in one or both eyes, or you have sudden blurriness of vision. Some patients say they have a blackout or like a shade comes over the eye. F is for face. Does my face look uneven? Is my eye droopy? Is my lip droopy, right? Do I lose the folds by my nose? If I stick out my tongue, is my tongue going to one side, right? All you have to do is look, right? If I look asymmetrical, a little off, and I now have a face droop, my eye is droopy, my lip is droopy, don't wait. My speech, if suddenly my speech is slurry, right? That's new, not normal, right? I'm talking very clearly, and now my speech is slurry and you can't understand me. That's a problem. That's an S as a part of BFAST or FAST. If a patient cannot get their words out, and it sounds like a jumbled mishmash of what we call word salad, meaning you're saying healthy smoke, limit my day, medication, right? That sentence did not make sense, right? So that is somebody who's having trouble expressing a clear sentence. That's speech difficulty. So I hope these examples that I just gave resonate. And so if you see this in the future, don't waste, what's that last letter? T. Don't waste time. Call 911 immediately to get EMS on scene to assist you or your loved one. So prevention, what can you do to prevent an event, right? That's what we're trying to do. These tools and tips and educational forums are for you to build up your armamentarium, to build up your resources so that you can prevent an event. So we have to have daily physical activity, heart healthy meals. If you're smoking, stop. If you're drinking alcohol, limit. And if you're on medication, adhere. So for physical activity, what are our recommendations? So AHA guidance, 30 minutes a day, 5 days a week. And that can be walking, cycling, swimming, jogging, skipping rope. So there's innumerable ways that you can get up and get moving. You say, well, I'm not doing anything, I'm technically sedentary, I'm going to go join P90X, right? You may last 2 days because it's a shock to the system. So if I can give one piece of advice in addition to this physical activity is, if you're not doing it, start doing something. If you're doing something, do more, right? It's not 0 to 100. Slow and steady wins the race, right? So you start and condition your body. And if there's any questions about this, we can talk about how to start an exercise regimen. Heart healthy meals, key thing, avoid fried, processed foods that are heavy in salt and sugar. So the 3 B's, bake, boil, or boil it, are a good rule of thumb. If you're smoking, again, as I said, stop. Today's the day. Every day is a new opportunity to stop smoking. And this is vaping, this is cigars, this is cigarettes. That just increases the inflammation, and it accelerates, it speeds up the rate at which cholesterol deposits in your arteries. Every cigarette that you put, every cigar, every marijuana stick, every vaping stick that goes past your lips increases your risk for heart disease and stroke. Limit alcohol. So what are the rule of thumb? So for women, 1 or less a day. For men, 2 or less a day. And medication adherence. If you're having difficulty with medication, there's tips and tricks. There's alarms that you can set. There's calendars with medication tick boxes, and I can share these resources. There's pill boxes. If you are a non-English speaking person, there's pharmacies now that are putting alternative languages, Spanish, Cantonese, Korean, on the labels. Right, so if English is not primary language, or French, Creole, ask your pharmacist if they have non-English labels for you. And then, of course, in the time of COVID, many people have neglected to maintain their primary or specialty care. But now technology boon has taken over in medicine. We have so many ways to contact you, whether it's a telemedicine visit, whether it's through email portals. But the message is, please do not neglect your medical care. It is important to maintain preventative care as well as your specialty care. So primary care, that's PCP, general medicine, and specialty. So as a cardiologist, we're a specialist, neurologist for the brain, nephrologist for the kidney, and whatever else you would need. Please don't delay. Here are my references, which can be posted for you later. And then in honor of Juneteenth, I thought it fitting to have a quote from Barack Obama, which says, Juneteenth has never been a celebration of victory or an acceptance of the way things are. It's a celebration of progress. It's an affirmation that despite the most painful parts of our history, change is possible. And there still is so much work to do.